Earfold. Implantable clip system for correction of prominent ears. Earfold implant pinoplasty is so minimally invasive, brilliant new technique, that is the next step in ear pinning surgery. The earfold consists of a thin strip of highly elastic metal nitinol, nickel titanium alloy, plated with 24-karat gold to reduce visibility under skin. The implant is just 5 mm wide, 15 mm long and approximately 0.15 mm thick, weighing 0.068 grams. The earfold implant is a new cartilage-sparing option intended for use in patients 7 years of age and older. The primary function of the earfold implant is to reshape the antihelical fold without causing major damage to the cartilage. The earfold system involves 3 primary components: the pre-fold positioner, the permanent earfold implant, and the earfold introducer. The pre-fold positioner is a non-sterile version of the earfold implant, which is placed onto the anterior surface of the skin of the ear. Pre-fold is used to determine the optimal position, number and orientation of earfold implants to achieve a particular outcome. The earfold introducer holds the implant in a flattened position before deployment. The introducer and implant are intended as single-use items. A subperichondral tunnel is created that extends 2 to 5 mm beyond the area marked for the position of the implant. B. Multiple through-and-through perforations of the cartilage may be necessary to enhance cartilage folding if the cartilage is particularly stiff. C. Insertion and deployment of the implant using the introducer. Earfold implant returns to its pre-programmed shape, folding the ear cartilage in the manner predicted using pre-fold. Advantages of the earfold implant: short recovery compared to traditional otoplasty. Patient can choose the position of ears himself before the treatment. Fast treatment as the procedure typically takes about 20 minutes for both ears. The procedure is carried out under LA in a clinic environment. The earfold implants are biocompatible, so if, for whatever reasons, you are unsatisfied with the outcome of the surgery, the implant can be removed, i.e. reversible and adjustable treatment system in the event of an unsatisfactory outcome. Disadvantages of the earfold implant: the implant is not designed to address a deep conchal bowl. Palpable edges are unsightly, increase the risk of skin erosion, and constitute a technical failure since the implant should be flush with the cartilage after deployment. Of course, an earfold implant isn't always the answer. Each patient is different, and depending on why your ears need attention, and their exact positioning, standard ear pinning surgery may sometimes still achieve greater results than the earfold implant alone. The intention of earfold is not to replace existing otoplasty techniques, but to provide patients with an alternative that is rapid and predictable with low recurrence rates. Trick: if a patient has a protruding ear as a result of cartilage excess but has a normal antihelical anatomy, only the Davis procedure is necessary. If a patient does not have conchal excess with abnormal antihelical anatomy, only a mustard procedure may be necessary. In reality, most patients with protruding ears have a combination deformity of posterior cartilage excess and an undefined antihelix. These patients require both procedures, i.e. mustard and Davis, and this is my favorite choice. Aftercare instructions. In traditional otoplasty with a post-auricular incision, it is important to close the incision meticulously to minimize the postoperative scar. Post-auricular skin closure is the surgeon's signature. This anatomic area is cosmetically silent, but should be closed with the same attention to detail that is given to any other wound. Skin closure is performed with subcuticular absorbable sutures, leaving 3 small, 3 to 4 mm gaps to allow egress of blood and decrease risk for hematoma. That is bathed starting on the 7th postoperative day and dissolves very shortly thereafter. It obviates the discomfort of suture removal, especially in children. A fluffed, dry, all-cotton gauze dressing is wetted and carefully placed into the new antihelical folds and the concus and soaked with an antibiotic-containing preparation and fixed by a head bandage. Control of the new ear contours in the early postoperative period is very important. The effects of shear, especially in the younger patient, can be disastrous. The gauzes are held in place with cling wrap. The patient is seen the following day for dressing removal and wound inspection. Any collection of blood should be evacuated immediately as hematoma can be very detrimental and deforming. The new dressing remains in place for 7 days. A traditional mastoid bandage that may be required for uncooperative children. The patient is then instructed to wear an ear protector, either a swimming ear protector or a tennis sweatband, each night for a month to prevent accidental stresses on the ear during sleep. I prefer to use petrolatum gauze cut into 5 5mm strips and packed along the newly shaped anterior and posterior ear surfaces. This dressing is covered by fluffed 4 by 4 inches gauze sponges and elastic net bandage over the face. A gap is cut over the eyes, nose, and mouth, while the inferior edge is pulled under the chin for patient comfort. This dressing is left in place for 48h and is removed when the patient returns to clinic on second postoperative day. In addition, peri- and postoperative antibiotic prophylaxis over 7 days with a cartilage-penetrating agent may be used in cases of extensive cartilage-weakening surgery. At the 7th to 8th postoperative day, the sutures are removed and the dressing is replaced by a headband. The headband should be worn for another 4 to 6 weeks, at least at night, to prevent accidental kinking of the auricle. Vigorous activities such as sports and dancing are permitted 1 month from the day of surgery. After the dressing is removed, showers and shampooing are allowed. Gentle scrubbing of the postauricular suture line is necessary to encourage suture dissolution. Don't smoke or being around others who smoke for at least 2 weeks after surgery. Poor healing, irregular scarring and delayed recovery can all be caused by smoking. Don't panic if you see discharge coming out of the ear. A cotton swab and hydrogen peroxide may be used to clean the external part of the ear. If the drainage is excessive, it should be investigated. Keep head elevated for a couple of weeks to minimize swelling. Avoid bending over, an action that may also increase the risk of bleeding. Swelling normally lasts for 1 to 2 months, with residual swelling lasting for up to 6. Don't scratch at incision lines to prevent damaging them. Itchiness is usually a sign that they're healing and the nerves are regenerating. Please note that if the itchiness is accompanied by redness, discharge or heat, there may be an infection. Avoid prolonged sun exposure and extreme temperatures for about a month or 2. The ears will be numb for a few weeks. As a result, they may not feel any damage that could be caused by extreme temperatures. Hairdryers should not be used to prevent burns. Scars will take about a year to fully mature into thin, silvery lines. Until that time, avoid tanning to prevent hyperpigmentation. Attention! A major factor in the course of healing is whether you follow the instructions given by your surgeon and the nurses in the surgery. Such guidelines are designed to promote the healing process and to prevent the occurrence of anything that may interfere with your recovery. It is imperative that the patient has to recognize that he is a partner in this process and has a responsibility to follow instructions carefully. The instructions, based on broad experience, are designed to give all patients the best opportunity for healing without delay or surprise. Depression is a normal reaction to surgery. The 3rd day following the surgery may be the worst. You may be teary. It is not uncommon to experience a brief period of letdown or depression after any surgery. You may subconsciously have expected to look and feel better instantly, even though you rationally understood that this would not be the case. Day 3 post-surgery may be the worst. As healing occurs, these thoughts usually disappear quickly. If you feel depressed, understanding that this is a natural phase of the healing process may help you to cope with this emotional state. Complications of otoplasty.